Assalamualaikum and hi Dr. Hartini and my friends. My name is Aminah Naisa binti Muhammad Kasim. Today I would like to present to you our introduction poster on the topic of Duchenne muscular dystrophy. So, let's start. Duchenne muscular dystrophy (DMD) is the most common childhood form of muscular dystrophy. DMD is a genetic disorder causing progressive muscle weakness and degeneration of skeletal muscle. It is classified as dystrophinopathy caused by mutations in dystrophin gene. Dystrophin is a protein essential for maintaining healthy muscle. Without this protein, muscle cells become fragile, easily damaged, and are eventually replaced by fat and scar tissues. DMD affects approximately 1 in 3,500 to 5,000 live male births worldwide. Globally, about 20,000 children are diagnosed every year. DMD is an X chromosome disorder. As you can see, the gene is located on the X chromosome, which is why it primarily affects males. Males have only one X chromosome. If that gene is mutated, they will develop the disease. Females have two X chromosomes and typically serve as carriers of the mutated gene. While the disease is typically inherited to the mother, about 25% of cases occur spontaneously in people who do not have family history of DMD. Now, I will hand over the time to my friend Haziq, who will elaborate more on the genetic mechanism of DMD.
Assalamualaikum warahmatullahi wabarakatuh. My name is Ahmad Haziq bin Hassan, and I will be explaining about the genetic mechanisms of DMD. To understand the genetic mechanisms, we need to look at the DMD gene itself. It is one of the largest known genes in the human body at 2.5 megabytes, located at XP21.1 of the X chromosome, containing 79 exons and 78 introns. The transcript mRNA is 14 kilobytes, generating a protein that is 427 kilodaltons, comprising of 3,685 amino acids. The massive size of the gene leads to high mutation rates, and in some people it can occur spontaneously or through germline mosaicism or inherited from a carrier mother. The mutations occur in two hotspots, exons 4 to 9 and 45 to 55. The mutations are mainly deletions at 60%, duplications at 11%, and the remainder being small mutations in coding sequence and splicing sites. The mutation causes a complete lack of dystrophin protein expression, which is a very important cytoskeletal protein in muscle cells, which lead to membrane instability, calcium dysregulation, inflammation, disruption of mitochondrial energetics, dysregulation of reactive oxygen species, as well as fibrosis or tissue scarring.
Assalamualaikum and hi, my name is Nurdaina Jasmira Hamdan and I'll be explaining about symptoms of Duchenne muscular dystrophy. Duchenne muscular dystrophy or DMD is a genetic disorder that mainly affects children that cause progressive muscle weaknesses. One of the earliest signs of DMD is delayed motor milestones, such as difficulty in standing, sitting, or walking independently. Children often show general motor delays and may experience delays in walking. As they grow, clumsiness and frequent falling become common due to weak muscles and poor balance. Many children with DMD also develop gait problems, including toe walking, and some may have flat-footedness. Muscle weakness can affect learning as well, leading to learning and speech problems. Also, cognitive delays. Growth may also be affected, resulting in short stature. Physically, DMD has several characteristic features. Children usually have big calves, known as pseudohypertrophy, along with thin and weak thighs. The knees are usually appears bent, and balance is usually poor, leading to falling. Many children walk on their toes due to muscle tightness. Other visible signs include a curved back, weak buttocks, and protruding belly, also awkward arms and shoulders. It is caused by weakened upper body muscles. Early recognition of this symptom is crucial for timely diagnosis, management, and treatment to support these children with DMD.
Hi and Assalamualaikum. my name is Nurul Aini binti Nur Termizi. Today I would like to explain about how to diagnose Duchenne muscular dystrophy, which is DMD disease. Duchenne muscular dystrophy, DMD, is a genetic muscle disorder in which muscle damage begins at birth. However, symptoms are usually not noticeable until a child is around 2 or 3 years old. At this age, parents may observe delayed walking, frequent falls, and difficulty running or problems climbing stairs. Despite these early signs, many children are only diagnosed at around 5 years of age, indicating a delay between the onset of a symptom and confirmation of the disease. Firstly, the diagnostic process usually begins with a blood test to measure creatine kinase or CK. Creatine kinase is an enzyme released into the bloodstream when muscle cells are damaged. In children with a Duchenne muscular dystrophy, CK levels are extremely high, often many times above the normal range. Although an evaluate CK levels does not confirm DMD on its own, it strongly suggests muscle damage and the need for further testing. Following this, genetic testing is performed and is the most accurate method for confirming the Duchenne muscular dystrophy. These tests involve analyzing a blood or saliva sample to detect mutation in the DMD gene. Genetic testing helps confirm the diagnosis, identify the specific type of mutation, and guide treatment options and identify carriers within the family. Somehow, in rare cases where genetic testing does not provide clear result, a muscle biopsy may be performed. A small sample of muscle tissue is examined to assess the presence of dystrophin. For your information, dystrophin is a protein essential for maintaining muscle strength. In Duchenne muscular dystrophy, dystrophin is usually absent or present at very low levels, which strongly supports the diagnosis of DMD.
Hello, my name is Nur Shifat binti Ahmad, and now I will be explaining about management and intervention for DMD disease. Today, we are looking at the management of Duchenne muscular dystrophy, or we call it as DMD. Since DMD is a progressive condition, so our current approach is multidisciplinary, which is focusing on maintaining quality of life and slowing disease progression. So, we can break current management into 6 key pillars. First one is corticosteroids. Corticosteroids remain the gold standard to help maintain muscle strength and prolong the ability to walk. Secondly is cardiac medication. Because DMD is affect the heart muscle, doctors use ACE inhibitors or beta blockers to protect heart function and manage cardiomyopathy before symptoms even appear. Thirdly is respiratory medication. As the diaphragm weakens, so we use specialized treatments and equipment like cough assist machines or non-invasive ventilation to support breathing and clear the lung. Next is physiotherapy. This is vital for maintaining flexibility and preventing joint contractures through regular stretching and adapted exercise. Orthopedic management is also the main treatment. These include the use of braces and standing frame to maintain alignment or surgery to manage conditions like scoliosis. Last one is balanced diet. Nutrition is critical, so we need to focus on weight management and bone health, often supplementing with calcium and vitamin D to counter the side effect of long-term steroid use. Now, we are moving to our second slide. The landscape of DMD is changing rapidly. Where there is no cure yet, we are moving from treating symptoms to treating the genetic cause. First is gene therapy. This is a breakthrough one-time treatment. It uses a viral vector to deliver a microdystrophin gene into the body, which is allowing the muscle to produce a functional version of the protein they are missing. Second is exon skipping therapy. This acts like a molecular patch. It tells the body to skip over the damaged part of genetic code, which is allowing the production of a shorter but still functional dystrophic protein. These therapies are revolutionary because they aim to significantly slow down the muscle wasting process at its source.